Orthotropics and mewing is increasingly popular on social media, and you might have heard some horror stories about teeth extractions limiting your tongue space and even preventing you from taking a breath. If this is true, why are we extracting teeth then? Yes, some studies do show this, but what do they actually say and what can be done to prevent this? If I'm being honest, during my whole specialty, I have never heard anything about teeth extractions limiting the airway space. The first time I heard of it was during the CEDO conference in Rome. There we had a few lectures that touched on the topic, but they all spoke about it in past tense. That was tried on professional athletes, idea being that you would increase their airway space, which would increase their performance. However, they stopped doing the expansion because it just didn't work. However, I did some digging and there really is research showing this. If there are studies showing this, why are we still extracting teeth? Well, first of all, this doesn't really seem to be a problem, at least when it comes to airway. I have never had a patient who had any airway problems after the therapy, and I have never even seen a patient who has this complaint. It's a pretty fringe problem that seems to be more like a concern of patients due to the popularity of mewing and orthotropics than an actual problem to be solved. Please note that if you have airway problems, the orthodontist is not the first address you should contact. Like, go see an ENT specialist, pulmonologist. Start with something, and if everything else is ruled out or they send you to an orthodontist, then fine, there are some stuff we can do. However, the tongue is a big problem for us, and it is something that we have to take account during the initial planning phase of your treatment. Now, for us, the tongue is not the problem because it's going to get stuck there, it's not going to have room, it's going to limit your breathing or something like that. For us, we have a problem with tongue just because it's going to push on your teeth because of the potential relapse after the orthodontic treatment. If we are not teaching you how to breathe, how to swallow properly, where your tongue should be positioned during the day, then the relapse is imminent, because no matter how strong the retention is, it's still not going to be enough because the tongue is that strong. It's extremely important during any kind of orthodontic treatment that we, in addition to aligning teeth and fixing your bite and everything else that goes with that, we correct all the bad habits. We teach you how to swallow, we teach you how to breathe properly, we teach you where is the resting position of the tongue, which is similar, or I should say same, as they do in myology, orthotropics, mewing, whatever else the modern terms are for something we call myofunctional orthodontics, basically. So when we go back to those same studies that everybody is citing against teeth extractions, they gave us the solution to any potential problems with airway as well. What they're actually saying is that teeth extractions are doing that. So that allows us to plan for the space, which, by the way, we are doing anyway during the initial treatment plan, because we are accounting for the tongue and we want to leave the room there, because, as we said, after the treatment, tongue, if not controlled, if not enough space is left for him, if not properly trained, it's going to push on all those teeth and open spaces between them, causing relapse. So we are accounting for that anyway, but honestly for a different reason. So what are we actually doing to negate this problem? The studies showed the same thing as well. We move the teeth forward. So after we place brackets, we extract teeth. Initial space is used to relieve the crowding. After that, all the remaining few millimeters of space, because if it's not few millimeters, then why did you even have extractions? Now, I see this mix up a lot, and I mean a lot. People are not distinguishing between sagittal plane, which is this, and transverse plane, which is this, basically. So, like when you say expansion, it talks about the transverse plane, so how wide is your upper jaw. In this case, when we're closing spaces, we're talking about specifically your sagittal plane. So we're moving teeth like this. We are moving everything forward, keeping your space, let's say space for your tongue, so that it remains the same. And also, in addition to that, your face stays the same, because your lips, your everything here, it's held by the position of your frontal teeth. So this is not changing. Honestly, it's even getting better. Let me show you. If I take an arch and I place it on these incisors, whether we are extracting teeth or not, this arch is much wider than your tooth arch, and this is by default. Unless we are doing some bending to make it more narrow, it's always going to widen your jaw. It's doing that by default. So all those things, when people are saying that teeth extractions are making their smiles more narrow, less aesthetic, it's BS. It's not true. Whether you're doing teeth extractions or not, your smile is going to get wider. There you go. We have options to prevent this whenever it's potentially a problem. If you're deep in the rabbit hole and all you're seeing is alternatives to teeth extractions, this is the video to watch.